My name is Peter Ryan. I'm farming just outside Wicklow town with my parents. We're farming 230 dairy cows. We're a predominantly grass-based spring calving system. We were having issues with pneumonia between 2 to 4 weeks of age. They were getting temperatures, they were slightly off their milk, they were getting small scours, and we weren't happy with the thrive they were getting. We decided to start using Bovilis intranasal after we had a discussion with our vet Mark from Avondale Veterinary. He told us that our risk period for our herd in particular was between 4 to 6 weeks of age, and if we vaccinated them from birth, they had protection from 7 days on. Since using Bovilis intranasal, we've certainly seen a reduction in pneumonia. We have found that calves are on an upward trajectory from birth as opposed to getting that hit at 2 to 6 weeks of age. They have less temperatures, their thrive is much better. When a calf is born, it's given 3 litres of colostrum within 2 hours of birth. We're testing all the colostrum, ensuring that it's over 25 in the refractometer. The calf is then tagged, its navel is dipped in iodine, and we give them a shot of the Bovis intranasal up the nose. We find the vaccine very useful as we are getting all the jobs with the calf done on day one. I'd advise other farmers to talk to their vet and come up with a plan on how to tackle their problem. We're delighted with the vaccine as we find it very easy to administer. We're giving it to a small calf from day one, and they have protection from day 7 on, which gives us real peace of mind. And we've seen a reduction in the amount of pneumonia we're getting. We're using less antibiotics. The thrive in the calves is much better, and I'd highly recommend the product. We are absolutely delighted with it here.
The issues that I was seeing on Peter's farm probably 2 or 3 years ago, we were getting a lot of pneumonia in the calves between 2 and 6 weeks of age, roughly. Came out, examined them. Most of the calves in the pens had high temperatures, over 40 degrees, and they'd be after milk, they'd be, typical respiratory disease. So generally, what we do in that case is we take swabs. It's the best way to get a quick diagnosis. So we'd have swabbed the calves, sent them to the lab, we got results back positive for RSV. So RSV is a very severe virus. It spreads very quickly in calves, especially when they're in a shed together, close confinement, and it'll also lead to secondary infections as well, or bacterial infections. So we really want to get in with a vaccine and try and prevent the virus spreading between the calves. I would have recommended Bovilis intranasal. We can be given at birth. They'll work within, be fully effective within 7 days, and it'll last for 12 weeks. So it's really convenient. You can vaccinate them the day they're born, and you'll have cover there for 12 weeks. And they're generally going out of the shed at that stage anyway, so the risk period is usually in those first 12 weeks. Once they go out, then the risk will be much less.
Bovilis intranasal RSP Live is a live intranasal vaccine for calves to reduce clinical signs and viral shedding from infection with RSV and PI3, 2 very common causes of viral pneumonia in calves. This vaccine can be administered to calves from the day of birth, providing protection as soon as possible during that high-risk critical period. Bovilis intranasal RSP Live is supplied in a pack with 2 vials, a lyophilizate, which is a pellet, and a solvent, which is a liquid. To prepare the vaccine, withdraw the solvent, the liquid, from the vial. Then transfer the solvent to the lyophilizate, the pellet. And shake well. And now the vaccine is ready to be administered. Administer a single 2 ml dose intranasally in 1 nostril, with or without a spraying device. Administer this vaccine to healthy calves only. Also administer to calves 5 to 7 days prior to a risk period or increased infectious pressure. Once the vaccine is mixed or reconstituted, use within 6 hours. The vaccine should be stored in a refrigerator at 2 to 8 degrees Celsius. Full onset of protection against RSV and PI3 is 7 days. Duration of protection is 12 weeks after vaccination. Bovilis intranasal RSP Live is available in 1, 5 and 20 dose packs. Bovilis intranasal RSP Live is licensed for concurrent use with Bovilis Nasogen C, 1 vaccine per nostril from the day of birth. For further information, visit bovilis.ie or contact your own veterinary practitioner.